I will tell you at this point in my life, I definitely believe in chronic Lyme.
There's something going on.
There's
Sure.
something going
Yeah.
on.
Whatever we call it. Yeah.
Yeah,
Yeah.
I have had patients that, that have been diagnosed with rheumatoid arthritis or with chronic fatigue, fibromyalgia, and some joint pain, but just brain fog. They just don't feel right. And, doing a history is really important. I said, well, when did this all start? And sometimes it is very interesting how I was just fine up to this point. All right, well, what were you doing at this point? Doing a really comprehensive history. Do you hike? Do you have a dog? Where were you living? And was there a point where this really started? And often when you do a really good history, you find it was after this time. And well, yeah, I was hiking at that time. Some of them say, oh, maybe I got a tick bite, but I didn't notice anything, so I didn't do anything.
Whether it is a loved one or yourself, we have all been affected by Lyme disease in one way or another. Lyme disease can be a devastating and mysterious disease that is also becoming more and more common, and it is also underdiagnosed. Today's guest, Marna Regehr, is a nurse practitioner right here at Capital Integrative Health. She has a passion for disease prevention using traditional and complementary modalities. Marna also specializes in treating Lyme disease and is here today to discuss what Lyme disease is and what approaches we can take to treat it. I am Dr. Andrew Wong, co-founder of Capital Integrative Health. This is a podcast dedicated to transforming the consciousness around what it means to be healthy and understanding the root causes of both disease and wellness. Join us to learn more about Lyme disease and what you can do to support yourself or a loved one along the path of treating it and healing from it. Well, Marna, welcome to the podcast. So great for you to be here.
Thank you. Good to be here.
And Marna is one of our OGs at Capital Integrative Health, been here since the beginning. So we're so happy to finally have you on the podcast to talk about Lyme today. We know that Lyme disease is a really big topic, a really big concern for a lot of people, out there, a lot of listeners. Maybe they might have family members or themselves even, loved ones that have Lyme. But let's first start about you and talk about how you, Marna, got into integrative and functional medicine.
Okay, yes. I think, my sister was involved in sort of natural health many, many years ago, and she had her own little herb shop. And so I just had a lot of interest in it and a lot of influence from her. And then I was a nurse practitioner for a while or as a nurse, just working as a nurse for a while, and I thought, how can I really maybe help people, more with natural health? And I thought, going back to nurse practitioner school, maybe I could be a little bit more directive. And so that's what I did. And then my first job, I worked with a doctor that really taught me a lot in my very first practice. And he had a lot of patients that had Lyme. So I thought, integrative medicine. I didn't know that it had so much to do just with chronic disease and Lyme, but that's where I learned a lot about treating Lyme.
So you were already leaning towards more holistic medicine. You kind of stumbled into that practice, started learning about Lyme through your experiences with the patients there.
Exactly.
In Leesburg. How did you find those patients did with that kind of treatment, with more in-depth treatment of Lyme?
Lyme treatment is always a challenge, and some people, did definitely better, but it's always an ongoing treatment, for a while. But yes, in my treatment even here, as I have looked back at patients that I've treated with Lyme, I go, they do get better, And I mean, sometimes it's not, it's a process, which we'll talk about today, but you can get better as you treat the whole person,
Mm-hmm. Yeah, looking at all the systems, how they connect, mind, body, spirit.
Yeah. I know my first patient that I almost treated for Lyme, I thought, great, I'm going to put her on doxycycline for 2 weeks, and she's going to be healed. And the doctor that I was sort of working with just sort of remained very quiet.
Like that's the traditional
Yeah, right.
approach.
Because the integrative doctor I was working with, because he knew it's probably going to be a little longer process than 2 weeks.
There's more chapters in that book than the first chapter, right?
Yeah.
And you grew up in Kansas, so was your sister's herb shop in Kansas, basically?
Mm-hmm.
Was there any Lyme in Kansas?
not really. I never was aware too much of Lyme
Mm-hmm.
till I got more into integrative medicine.
Yeah.
I mean, no, in nursing, of course, I dealt with it as stuff as well. People that as a nurse, I definitely heard more about it.
Heard about it,
But
yeah,
I
yeah.
think it's not as endemic in Kansas, believe it or not, partly because I think, it's more wide open spaces,
Yeah.
and so there's not as many trees and
Right,
not
right.
as many deer, I mean, it's definitely there, but it's more endemic especially on the East Coast and on the coast.
Yeah, the wooded areas with
Yeah,
a lot of trees, forests and
yeah,
stuff. The ticks kind of hide in there.
Exactly.
Deer are,
Right.
Bambi or whoever's going
Right,
in there with.
exactly, right.
Hopefully, Bambi's not getting infected by a tick. But
Right.
And let's talk about how you started working at CAH. That was back in 2015.
Yeah, right. So my first job, like I said, was in Virginia, and I live in Maryland, and so I met Dr. Wong at a conference that we had together.
It's a networking dinner.
Networking dinner.
Yeah.
And then there was actually another doctor that was there as well. Anyway, so I think I just decided, that this sounded like a good fit, and didn't have to go keep up 2 different licenses and different things. And so anyway, so that's when I decided just to sort of exciting. You're starting a whole new, like I was here at the beginning, started a whole new clinic, So anyway, so
it's been a very fun journey. We're so grateful that you've
right,
been here
yeah,
and
right, exactly.
are here.
So it was
great.
It was great just to be able to have this transition. And at that time too, I was also still working just down the street as a school nurse, and stuff. So when I started here more, I was working part-time, and I worked part-time at that job. And then after a year, I thought, no, I'm just going to just work here.
Mm-hmm.
So that was convenient as well.
Yeah. Did you see any kids with tick bites there?
Oh, yes. Oh, yeah.
Yeah.
Oh, yeah, definitely. Definitely. Saw kids with ticks there and was by that point much more aware, and so tried to really direct them in the right direction. If they did get a tick bite, and watch them.
Yeah.
So.
Well, let's get into Lyme.
Okay.
Talk about Lyme disease. What is Lyme disease, and what causes it, and how is it transmitted for the listener?
Yeah. So basically, Lyme is just a bacterium that people can get from ticks. There are probably other vectors out there that you can also transmit them now, but we'll stick to ticks so we don't frighten everybody. I mean, but sometimes I think, now there might be other vectors that also can transmit to humans, like maybe even some mosquitoes or some other, maybe small mammals and stuff as well. But basically, ticks are very resilient, This tick, a fully engorged tick, that a female, that she can lay like 100 to 10,000 eggs at one time, a little larvae. And these little larvae then fall to the ground, and then they sort of shelter and hide in the grass, and then they find these smaller little vectors, like a white-tailed mouse is known to really be a nice vector for them in the early larval stage. And so then they feed on, they have to have some blood source to live. But they can live, unfortunately, 200 maybe to an adult can live almost like 430 days without a blood source. So, I mean, even if they're not feeding, they can still live. So anyway, this little larvae then just feeds, they have a blood source on a small mammal, like a white-tailed mouse or something. And then what they do is they molt into like a nymph, and these nymphs are still really very, very, very tiny. But these nymphs, then they look for larger sources, like a deer or a human. And so basically, with these vectors, not every tick has Lyme. So when they're feeding off some of these blood sources that have like a viral or a bacterial infection or bloodborne pathogen like Lyme, then those ticks pick it up, and then when they bite somebody else, then they can infect that person. Now the vectors themselves usually don't have Lyme, but if they do have some bloodborne pathogen like the infection like Lyme in their system, then the ticks unfortunately can pass it on to other people.
So, and how common is Lyme? You know, we know that the CDC has certain data, but my understanding is there's some underdiagnosis going on.
Yes, definitely. There's a lot of undiagnosed cases going on, and I think partly just even from an environmental standpoint, as we deforestation, basically when we're building into trees and everything else, and so the animals are becoming more concentrated, like deer and all this, and animals, a lot of mammals are being displaced, just especially in coastal areas or where there's heavily treed areas, Lyme is just becoming more prevalent, and it is very underreported. And I will probably get into this too, the difference between just getting bitten by a tick and getting Lyme, and then chronic Lyme. And chronic Lyme is probably one of the things that we'll probably talk about here in a few moments, that really Lyme can develop into a chronic issue. And that definitely is underreported and undiagnosed.
Yeah, so you said about habitat destruction, deforestation, crowding of the population, and then there's probably more human-animal interaction based on that.
Exactly.
Would climate change be also playing a role?
Well, I think yes, I think it could. Because that all ties together.
Mm-hmm. Like ticks probably like warm weather. Is that true, or do they like cold weather also?
Well, they're most prevalent where in spring. That's when spring and maybe early fall, I think. But spring for sure is where with their life cycle. But spring is often. And that's when people maybe go out more into the woods and stuff too. But spring is where you see more tick bites.
Got it.
And some areas, you can just be infested, with it. And yeah, like when I was working at the school, they take hikes and they come back with tick bites. They go, ugh.
Yeah, that's a problem with earthing, like going out and barefoot
yeah.
on the grass.
I know.
Yeah. It's really good for the body, but then it's like, is there going to be a tick there or
right.
not? That's the
One thing I tell patients now sometimes, if you're going to go on a hike, obviously there are some sprays that you can use. There's, some heavy socks that you can put on, but maybe just have even a little tea tree oil in your pocket.
Okay.
Because sometimes if you get a tick bite, if you notice it right away and you rub it with tea tree oil, it's not a 100% surefire thing, but it can possibly stop the transmission. Neutralize the transmission. So tea tree oil could be real good. Or sometimes even people say like they have a little bit of alcohol, and stuff. Obviously you have to pull the tick off, and that's a whole nother subject, But if you just feel like you got a tick that's not really latched on at that point, and just rub it with some alcohol or some tea tree oil, and it's a whole, people used to say, okay, the ticks need to be on there for like 24 to 48 hours before they can transmit Lyme, and that's just not true. It can be less than that and stuff. So that is sort of another myth that needs to be busted about Lyme and Lyme transmission.
Yeah. So just going back to the question about the tea tree oil. Is that a spray you can put on, or something you can use for prevention?
Yeah, prevention. Tea tree oil usually comes as a liquid, and so just, obviously if you have any cotton ball or anything, your handkerchief or whatever, just put some of the tea tree oil on it, rub it over that spot.
Yeah, on any skin that's exposed, like if people are wearing shorts
maybe
or
as a
t-shirts.
prevention. I don't know if you could just put it all over. There's some other sprays. There's some natural sprays that you can use. I have to remember the name of that, but there are some natural sprays that you can use. Then there's also permethrin sprays, that you can use as a prevention.
That ticks would be less likely to jump aboard because they can smell the chemicals and stuff.
Yeah. Mm-hmm.
Got it. Okay. And then, like you said, this 24 to 48 hours of having the tick on the skin before getting infected is a myth. Can you talk more about that and kind of get into acute Lyme first and then get into chronic?
Yeah. The good thing is, what you have to say, a lot of patients do say, well, I just was on for a short amount of time. Well, and we have seen cases, with Lyme, especially a lot of doctors that treat Lyme, that the tick does not need to be on there for, even this less than 24 hours, it still can transmit. And so it is really important to get early treatment. So if you get a tick bite, you do need to let your practitioner know. I mean, obviously, you need to remove the tick. I mean, there are different ways to remove the tick. I mean, obviously, you can take a tweezers and be sure you grab it by the head, not the tail, or anything like that, so you can really pull it out. A lot of people are really concerned because, even after they pull it out and they truly have gotten it out, there's just a little hard spot and a little red dot right there. And that's because they inject almost when they're feeding, they inject almost this like cement-like liquid that you will have a really tiny little spot that feels hard, and that's normal.
Okay.
Because that's just because what they inject, it becomes really hard. Doesn't necessarily mean that it increases your chance of getting it, but that will be there. So several things to do here is save the tick, because you can get it tested for Lyme. And so there's Klongen Labs is one, and there's other labs. But
that's locally in Gaithersburg.
But that's locally
Yep.
in Gaithersburg. Klongen Labs
Okay.
is locally in Gaithersburg that you can send the ticks
Great.
for testing. I mean, like if you just test for just the regular Borrelia burgdorferi, I think that's just one price, or maybe even that one's free. But and then if you want to test for a lot of different types of Lyme, then it gets a little bit more expensive, but it is really a good thing to just send them in, because it is like the Lone Star tick that usually doesn't, spread Lyme. It's the black-leg ticks that really spread Lyme. So even having just another expert look at it can really be helpful, and can help determine treatment as well.
And there's also a difference between the traditional Lyme tick, which is the Borrelia burgdorferi, and I think the brown, the Lone Star tick is brown, I believe, correct?
It could be.
It could be, okay.
Yeah,
but
yeah.
this idea that I know the Lone Star tick can actually cause this alpha-gal allergy to red meat.
Oh, really?
There's
Yeah.
this issue with sometimes people get bitten by the Lone Star tick and they get a red meat allergy.
Oh, right.
So that would be an interesting.
Yeah,
kind
that
of
would be an interesting to
differentiation.
follow up. Yeah.
But yeah, if people can go to Klongen, that's a good. That's a good lab.
Yeah, just to
Good
get
lab.
them. That's a very good point.
Although it's probably not free. They
Yeah,
probably won't offer free
Yeah,
testing.
that's a good thing to remember. So yeah, thank you for sharing that.
Yeah,
And,
sure.
And so I think another thing that I just want to mention here too is that a lot of people think, oh, you have to have this bullseye rash, and most people, maybe only 50% of the people get like a bullseye rash, or even less than that. So even if you don't get a bullseye rash, doesn't mean that you have not been infected with Lyme. And just remember that bullseye rash doesn't have to be over the site of where you got the bite. It can be at different places,
Huh.
It doesn't necessarily have to
Yeah.
be right at the site where you got the bite. So it is something to look for, but it's not necessarily definitive.
I think that, Marna, you really hit the nail on the bullseye, so to speak, with that bullseye rash. We know about, integrative medicine often deals with shades of gray.
Yes.
Like in traditional medicine, when it's like black and white, did you get a tick bite or not? Okay, if you didn't, if you don't remember it, you don't have Lyme.
Right.
But that's not necessarily true because, people's memory, that could be questionable.
Right.
It could be that the tick was on there and then it fell off, but then the bite happened before.
Right.
So there's many things that can happen.
Exactly, and one of
Yeah.
the really in reference to that, one of the most important things with that is the nymphs are one of the most infective.
Okay.
The adults can infect you as well, but nymphs are so tiny.
Hard to see.
They're so hard to see that you might not even know that you gotten bit. And, so then you might have gone to shower, might have fallen off on its own. But that they are so tiny that sometimes you don't see them and you don't notice them.
What are some other typical symptoms besides a rash? What other symptoms of acute Lyme if someone's kind of wondering if they should go see their practitioner?
Right. I tell all my patients, if you have a tick bite, just call me.
Yeah. Okay.
But still, for an acute Lyme, for an acute bite, like sometimes, like kids, I've had, this is a good example of a kid that goes to camp, and gets a tick bite. And sometimes ticks, one of the things that they can just really transmit, even apart from the regular Borrelia burgdorferi, is anaplasma. And with anaplasma, what they do is that you can get a fever. You can get a pretty high fever, and you can probably get some muscle aches and pains and stuff as well. But again, just to, like with anaplasma, usually all you have to do is literally treat 2 weeks with the doxycycline, and that will resolve that anaplasma. And so that's just one example I think about off the top. But again, just in general, just even with Lyme, you can develop knee pain, and that is one of the classic signs, even with acute, like joint pain, headache. You may or may not have a little fever, but you just make malaise, not feeling good, but joint pain. And joint pain is definitely, obviously in some cases, but not a lot, you can get really swelling, on the knee, and so then you can aspirate that. I can be aspirate that to see too if there's any Lyme there. But basically, for acute, you just need to watch for joint pain, malaise, just not feeling good. Watch for the rash, for the bullseye rash. Those can be some acute markers.
It sounds like joint pain is a possible differentiator. Like other symptoms sound almost like flu-like symptoms.
Yes, right.
Although you don't have to have joint pain, right?
You don't have to necessarily have joint pain, especially initially, especially when we get talking more into the chronic issue.
Right.
But those are some of the acute symptoms. And really, if you catch it in the acute symptoms and you don't have any other underlying, immune issues, then often just treating with doxycycline for a month. I usually still treat for a month. There's been some theories that doctors have just do 2 days of doxycycline. I go, no, we need to do, probably minimum 2 weeks, usually a month, just to be sure that it gets covered, because we do not want this to get into chronic Lyme.
Right. And let's actually go into that rabbit hole of chronic Lyme now.
Right.
Gonna go like Alice in Wonderland down that rabbit hole. What are some of the potential chronic symptoms of Lyme? And this is also a controversial topic in some ways.
Yes.
In terms of, some practitioners, some societies don't really believe in chronic Lyme even.
Right.
So let's just talk about chronic Lyme.
Right. I will tell you, at this point in my life, I definitely believe in chronic Lyme.
There's something going on.
There's something going on.
Whatever we call it.
Yeah. I have had patients that, that have been diagnosed with rheumatoid arthritis or with chronic fatigue, fibromyalgia, and some joint pain, but just brain fog. They just don't feel right, And, doing a history is really important. I said, well, when did this all start? And sometimes it is very interesting how I was just fine up to this point. All right, well, what were you doing at this point? Doing a really comprehensive history. Do you hike? Do you have a dog? Where were you living? Was there a point where this really started? And often when you do a really good history, you find it was after this time. And, well, yeah, I was hiking at that time. Some of them say, oh, maybe I got a tick bite, but I didn't notice anything, so I didn't do anything, Or a lot of times they have no idea. But then, like what we do here in Integrative Health, what we do is we do more in-depth testing. And sometimes these people then have just lit up with their Western blots have been positive, or we do some testing more for comorbidities. I mean, not comorbidities, but other. Lyme doesn't only just give you Lyme. There's other things that... Co-infections, exactly, like Bartonella, Babesia, and we can talk about some of the differentials with that as well. But, and some of these patients then are just so relieved just to have a diagnosis. Some of them, I have a patient recently that has been to just special neurologists and in pain management doctors in New York and all these specialists, and so wasn't sure either what was going on with her, but then just did some Lyme testing and it has just lit up, so there's a lot of people that come in here with just chronic, the things that I already mentioned, like chronic fatigue, joint pain, fibromyalgia, just not feeling good for years. And then when we work them up for Lyme, it really is positive. POTS, a lot of times if you have POTS, a lot of people have POTS syndrome, and POTS syndrome is really associated with Lyme, And so they're being treated for POTS, but they're still not getting better, so.
What is the root cause? I mean, that's
what is the root cause? Exactly.
Like an archaeologist digging in there,
right? Exactly, right.
A lot of these autoimmune diseases, POTS, Hashimoto's.
Yes.
Some of these things can actually be caused by Lyme.
Yeah. Absolutely.
And I think in traditional medicine, we don't necessarily do a great job of being archaeologists. We're almost like, if something's on the surface and it's not there, then it can't be there anymore.
Exactly.
But we know that Lyme is really a stealth infection.
Yes.
It hides in the cell, right?
Exactly. It does. Especially, I mean, like speaking of one of the co-infections, like Babesia.
Yeah.
Babesia can be an intracellular. There's lots of times that there's a lot of different types of Babesia.
Okay.
But one type can be an intracellular. So then it can cause anemia and can cause like low hemoglobin hematocrit and cause anemia. And so that can be one sign too that you have to watch for. So again, just digging deeper, and again, the history, so important. So.
Are you a fan of science fiction at all, Marna?
Some of it.
Well, I mentioned that because it's kind of like Lyme is like a shapeshifter, like
Yes,
the creatures
exactly.
that are. Can
Right.
you talk about, kind of outline for the audience, the different types of Lyme? You know how there's different types
Right. And one of the
the
questions
organism.
when people come to me is I really do ask them some other questions. And so like general Lyme will be some of the symptoms that we have talked about. Then I sort of differentiate. Bartonella and Babesia are two real common co-infections. And so with Babesia, again, what I look at, obviously you look at your RBC, the CBC indices, and iron levels, just to be sure there's no anemia and stuff there. But one thing too, because some forms of Babesia can be an intracellular parasite, sometimes what is exhibited with people that have Babesia is a shortness of breath. I ask them, do you just have to take a deep sighing respiration intermittently? And often they'll say yes. So that's another sign of Babesia, is just the shortness of breath. Sometimes they can have like pain sort of on the bottom of their feet. I think that can probably be a little bit with Bartonella, just even on as well. Headache, emotional labile, just, mood issues,
With Bartonella?
With probably more with maybe more Babesia.
Okay.
Yeah. But another big thing with Babesia is sweats. Do you have just sweats? Not just night sweats, but you can have sweats and chills and fever with Babesia. So that is one thing, the shortness of breath, the sweats, chills and fever and headache, and of course the anemia and the sighing respirations. Then moving to Bartonella. Bartonella is hard.
Yes.
Bartonella is tough because Bartonella can often do more neurological symptoms. You feeling of like bugs crawling on your skin, neurological pain, like in your face, neurological pain, just sort of a pain along a nerve line, and a lot of paresthesias, as that also go along with Bartonella, and just really migratory joint pains, and now. There is a Bartonella rash, a real striae rash. So it's sort of like a stretch mark rash, and that is for a very, that's pretty much a clinical sign. I mean, you can have stretch marks for other reasons, but very distinct stretch mark-like rash. Some kinds can be vertical, but actually more horizontal as well.
Okay.
And that's another thing that you can look for with Bartonella.
Okay.
But it's a lot of the neurological symptoms, the paresthesias, nerve pain that is really sometimes really hard to deal with, and stuff like that. That's more of a sign of, like, sometimes they also describe sort of an internal vibratory feeling, and just
kind of these strange symptoms that are
mm-hmm.
hard to explain from traditional
and that can
diagnosis,
often be more Bartonella. So I ask the patients these questions because, obviously we can do more testing to ferret out whether it's more Babesia or Bartonella, but these symptoms can also help clarify.
So, in a way, finding these kind of infections or co-infections is kind of like finding a needle in a haystack.
Exactly.
Yeah.
Exactly.
How do we test, or how do we find, how do we identify Lyme?
Right.
Yeah.
Now, here at CIH, we have some specialized testing that we can do. So basically, there are some lab tests that I do. I do the Western blot. There's antibody tests that we can just do through LabCorp. But then what we do is we do some specialized testing too. We've often used and still continue to use hygienics labs, which is a little bit more, they add an extra band, sometimes two, I think maybe one or two extra bands that they do for their Western blots. And they can do some they do some DNA testing as well for like Babesia and Bartonella that we can do. So they are a very well respected lab that we use here that can give us a more differential diagnosis. And then what we've also been using here more lately is Vibrant mycotoxin labs. And what I really like about them is they do a whole panel of co-infections. And having recently gone to ILADS, ILADS is the International Lyme and Lyme Associated Disease Conference. A lot of really Lyme experts they use both hygienics and this Vibrant labs, and so there's just more testing always being developed. But this Vibrant mycotoxin, the co-infection one, can really be helpful in looking, because it tests for about, 4 or 5 different types of Bartonella, Babesia, Anaplasma, and then they do also some RNA testing as well.
Okay, good. Well, a lot of tests that are out there, some of these more functional tests, I think it's really important to know that for the listeners that those tests are out there. There's
Yes.
practitioners that can order them, because if someone's struggling with, months or years of chronic fatigue or
Yes.
fibromyalgia or
Right.
joint pain, headaches, whatever it is, and there could be Lyme or co-infections, having a negative lab core or sort of a more traditional lab test may
Right.
or may not rule out Lyme. How accurate is that lab
Right.
core test?
Oh, I agree exactly with what you said, because I've done a Western blot. Oh, there might be one band or two. I think, oh, I don't know. But when I go through all my questions and the symptoms, I think, I don't know. We need to test you further. And I've had people that the Western blot has been even pretty negative, and then some of the specialized testing just lights up.
Yeah.
So it is really important, and worthwhile to do some of the specialized testing.
Mm-hmm. They're more precise.
Yes.
Yeah.
Yes, exactly.
So we talked about Babesia, Bartonella, Anaplasma. We talked about Lyme a bit, acute and chronic. Let's kind of get into, for listeners, things that we might want to consider in terms of treatment steps.
Okay.
And sort of where do we go from here? We have a diagnosis of
I know.
Lyme now, and someone's actually
Yeah.
getting some light maybe at the end of the tunnel. How do they kind of move through that to get to the other side?
And let the fun begin.
Yes, exactly.
It is, I approach everybody individually, Definitely here, what I use, and I think all the practitioners here use, we do a combination of antibiotics and herbal supplements. There's several good companies that, like Nutrimedics has a lot of good herbal products. Byron White products, we use a lot of those. There's some other companies that I'm investigating a little bit more, for herbal products. And so it's usually a combination, Sometimes too, I think before we get into Lyme treatments per se, I think something that I think CIH does really well is that we look at the whole person as well. Maybe even before we do Lyme treatment, we need to look at their GI status. We need to look at their detox pathways. How are they detoxing? Because if I start somebody, or if we start somebody on antibiotics, but their detox pathways aren't open, or they just have their GI system isn't working properly, then all the things I throw at them may not be as effective, and so, and this is really interesting too. I've been going to ILADS, the conferences, for quite a few years, and and 4 or 5 years ago, it was all about, all right, what's this new antibiotic? What can we do? This new antibiotic, how we can do that, and how, and breaking, how can we give even some things that break up cysts, like nattokinase or cyst busters, so that even the antibiotics can be more effective. And so 1 year it was all about that, cyst busters to help the antibiotics be more effective. In the last couple years, it's been very interesting where the more the tone has been, and even the the title of one lecture was, "It Ain't Just One Thing," and so I think even the very people that treat Lyme, that are really Lyme literate doctors, are seeing it's not just treating Lyme, it's treating the whole person. And I think that's one thing that we do well here. And so that's probably where I start, is asking, what is the GI status? Are they having, do they have SIBO? Are you constantly constipated or something like that? So we need, or there may be mold or something, or heavy metals that we need to maybe detox first so that the treatment with Lyme can be the most effective.
It ain't only one thing. It sounds like right.
It ain't only one thing is right.
I love that shift in perspective, slight shift in perspective on my lads from, I think, just more of a bug-based versus like, yeah, we have to treat the bugs, but also nourish and strengthen a terrain, it sounds like, right?
Exactly.
Yeah.
Yeah. So then getting into actually treating Lyme after we've, done some of the preliminary work, it depends a little bit on the person. Some people really don't want to do antibiotics. Doxycycline is really effective for acute Lyme, but not so effective for chronic Lyme. Sometimes I start there anyway at the very beginning, so I just know I've covered all my bases. There's other. Obviously, I don't want to talk too much about specific treatment here because everything is very individual.
This is not a treatment podcast.
This is not a treatment podcast. But
Yes.
There is one naturopathic doctor that I have read about, and so she starts, somebody that's maybe come in that I suspect has chronic Lyme and has had it for a long time. Sometimes you start on a drug maybe like Tindamax, which actually is an anti-parasitical drug, but it also is a cyst buster, and stuff. So, you want to get, again, we think that ticks are very strong and have a strong on the outside, but when in chronic Lyme, they burrow in your system, they hide in your cells, and they do put these little protective walls around them, and so sometimes we need to, like, if we use a drug, an antibiotic or an antiparasitical like Tindamax, that can push them out, and then you might give them Zithromax after that because, okay, we're going to push them out and then we're going to try and zap them, but it's always important. One thing that I always do, you always need to do at least 2 therapies at one time, whether it is, like an antibiotic along with an herbal supplement of some kind. Like I use AL a lot. AL has been known to be advertised as doxycycline in a bottle, because it treats, AL stands for anti-Lyme. It's a Byron White formula. But because it just treats the gamut of a lot of different things, and so, but I think it's really important to do a combination of an antibiotic or herbal supplement that targets Lyme in some way.
If someone doesn't want antibiotics, then you could combine herbs?
Yeah, you could combine herbs as
okay.
well. You can if people if people do not want to do any antibiotics, then there's definitely some herbal supplements that I can start with as well.
There's multiple hiking pathways to get to the final
the same
destination.
Absolutely.
Okay.
They're absolutely. And some people just really, it's interesting. I had a patient one time that before she came here, she had Lyme so bad that she was wheelchair bound.
Wow.
And then what she did something called the Cowden protocol, and the Cowden protocol is like is like a Nutramedix, and so you're on it for about 9 months, and one day you take a little bit of this mixture of this tincture, then the next day you take this tincture, and the next day you take this tincture, and so for some people that I have treated with antibiotics, different things, sometimes I just, and if it has to be the right patient, it has to be the right situation. But sometimes just going on a long-term herbal treatment has been effective. This patient that was wheelchair-bound had done the Cowden protocol, and although she still had some Lyme symptoms, but she's not wheelchair bound anymore.
Yes, that's a great story. Thanks for sharing, Marna. And I know, we know here at CH that, the treatment of Lyme, like any chronic disease, also rests on the pillars, the foundations of health, like nutrition, lifestyle, stress management. How does that kind of play a role with Lyme patients, and what kind of recs,
Yeah.
would you recommend there?
Yeah. One thing, I think when you talk about those pillars, stress management is so important, nutrition is so important. Ticks and Lyme love sugar.
Okay.
They love sugar, and they love what's in, so you need to watch your sugar. You need to watch your alcohol, because there's a lot of sugar in alcohol. So limiting sugar and alcohol is really important. And stress, such a big factor. So important to deal with underlying causes of emotional issues. I think some people, especially with my original physician that I worked with that taught me a lot about Lyme, he said, some people don't get better because they haven't dealt with the underlying emotional issues. And when you deal with some of the underlying emotional issues, then you begin to heal.
So the immune system, in a way, is affected by the emotional
Absolutely.
balance? Okay.
Yeah.
That's a great point. That's a really great point. It's really mind, body, spirit.
It is really mind, body, spirit,
combination.
because if you're really stressed, that stresses your immune system, and that pulls it down. And so it's really important to deal with stress, because it does affect your immune system.
It almost sounds like the immune system is getting bogged down
Exactly.
by this emotional bandwidth that's getting taken up by
Right.
by emotional imbalances,
Yeah.
and then they can't fight the ticks as well and things
Yeah.
like that.
Yeah, very well said. Very good.
How about sleep? Any issues there?
Oh, yeah.
With
Sleep,
people?
of course, again, I think that's one of the pillars of health.
Yeah.
Sleep is very important, and for all of our health, health, very important for our brain health, and to be able to think clearly. And we all need sleep for restorative sleep, So sometimes maybe even doing a sleep study, but just purposely trying to, we have whole podcasts. I won't go into it. I'm sure there's whole podcasts that we do, and we have excellent classes just on sleep hygiene, of things that you can do, to get enough sunlight to during the day, so you sleep better, especially early morning, and basically to go to bed at a regular time. But sleep is very important. A little caveat here, too, with exercise. Exercise is really important as well. But when somebody is very fatigued to begin with, and they might start to get better, people want to go, okay, I'm just going to really push through with exercise. You can't, when you're doing some Lyme treatment, I sort of tell them not to over-exercise. You need some exercise for that circulatory system to just wake you up, keep you going, and it's so good for your mental health, but isn't the time to take on maybe a whole new heavy lifting gym routine.
Okay, all right. No marathons or something like that. So
not
medium
the time
dose.
to be training for
all
a
right.
marathon.
So a medium dose of an exercise prescription, it
Yeah.
sounds like would be really great.
Yeah, yes, exactly.
And I think I have to ask this question because, as you know, I'm really into brain health.
Yeah.
Does Lyme affect the brain? Can it cause brain fog?
Oh,
and things
absolutely.
Like
It's that's one of the big signs of Lyme is brain fog, and some of the antibiotics cross probably the blood-brain barrier. Others may not. But there's things that there's actually a tincture that I give,
Okay.
just to help with brain
With-
fog.
with that.
Yeah,
And-
so
and
I'm
Lyme-
not going to mention it. This
Yeah.
is not a training session.
Right,
here, but,
right.
so I'm not going to talk too much about products, but there's definitely things that I give just to help with brain fog.
Because Lyme can infect the brain. Is
Oh,
that
yes, it
correct?
definitely
okay,
can,
cross
yeah.
the blood-brain barrier.
Yes, unfortunately.
Well, if you have Lyme, you live in the area locally, go see Marna. Marna's Lyme expert here at CIH. We're so grateful for your words of wisdom here on really treating all pillars of health
Yes.
and looking at the entire terrain while also dealing with the microbe that someone might have, like Lyme or
Yes.
co-infection.
Yeah,
So
yeah.
thank you, Marna.
Oh, no, it's great to be here. Thank you.
Yes, and we are actually still on for some closing questions that we do like to ask all of our guests. So if you don't mind,
Okay.
we have a question about morning routine. So is that something that you do? Morning routines are really good for health, and we're just wondering if you have a morning routine.
Okay, morning routine. Yes, I do try, and I get up every morning. I mean, I think coming in, I have a commute. So sometimes even I try, and I don't do this routinely as much as I should. Sometimes even singing in the car. Sometimes I have this prayer that I use that's a rote prayer that I can just do every day,
Nice.
And so that is something that I do to try and help focus, say, okay, help me focus, help me get through this day. But it's a specific one that I
Okay.
used. And so
Nice.
that is something that I try and do sort of more in my car as I come in.
And of course, you know that singing to songs is a great way to stimulate the vagus nerve.
I know. So that's why I need to do that one more. It helps wake you up as well. That's a really good one that I need to do more of.
And lastly, we know that if all people's Lyme symptoms are quote unquote solved and they're symptoms, but they don't have joy, we know that this is like a big factor in health. So kind of what do you do to cultivate joy in your own life?
Right. I think for me, I mean, I really I love to walk, and I think that really clears my head a lot. That's probably the exercise I like is more than anything. I also like to bike, and then I think the really importance of interpersonal relationships. And I really try and keep up with, family and friends, and just it's very important for everybody to have a support system. I mean, obviously, we can have therapy, which is often really needed, particularly with chronic Lyme when individuals have been dealing with that. But even just to be purposeful in developing, a support system and have positive relationships around you.
Yeah. Deep positive relationships, connection.
Exactly.
That's really key to life. Right?
Exactly. Right. Yeah. And faith. You need to have faith, that there is somebody watching out for you.
Yeah, that's great. And we should actually, I think we should definitely talk about basketball as well. I know that's another favorite of your exercise.
Yes.
Keeping up with the teenagers, right?
Right. And Rock Chalk KU,
That's
team, won the national NCAA tournament this year.
Well, congrats to Marna and the Jayhawks this year, 2022. Thank you so much, Marna, for coming on today.
Right. Yeah, I do. And that is one thing I do for exercise. I love it. I go to a great school near me that has a basketball court. I mean, not in session. I can't do it all the time, but I love to just go play basketball because I like that better than running. Because you sure don't make the shots all the time, so you have to run back and catch your own. You get exercise that way, and you use different muscles with shooting and stuff. So I love to go shoot baskets.
Well, if you don't make it the first time, just keep shooting the ball, right?
I know. I have my sweet spot. I like to just do it. So
awesome.
It's great.
Well, thank you so much again, Marna, for coming on. Great to see you here.
All right. Thank you.
Thank you. Thank you for taking the time to listen to us today. If you enjoyed this conversation, please take a moment to leave us a review. It helps our podcast to reach more listeners. Don't forget to subscribe so you don't miss our next episodes and conversations. And thank you so much again for being with us.